What drew you to specialize in wound care?
I was exposed to a lot of oncology diagnoses, oncology situations. So it's something that came from that time. The patient has a low immunity that needs to be treated accordingly.
The healthcare professionals, what could they do?
Be up to date with what is happening.
Have there been any recent advancements?
There's been a lot of work done to try and make the dressings or the products more comfortable for the patients to use.
What kinds of challenges do people with cancer face when it comes to skin health and wound healing?
So there's a variety of challenges because...
Welcome to Oncology Revolution, where science meets care to transform the cancer journey. We explore evidence-based strategies to enhance quality of life, promote longevity, and empower patients and professionals to thrive beyond cancer.
Hello and welcome to the Oncology Revolution Podcast. I'm Raquel Maris. I'm an occupational therapist with an executive MBA, and I work as a project coordinator at the European School of Lifestyle Oncology. Today, our guest is Ines Pereira. She is a tissue viability nurse specialist and certified in scar therapy. She has worked across clinical, academic, and leadership roles and recently launched Wound Wellbeing, an independent service offering holistic, evidence-based support for patients, caregivers, and healthcare professionals. Ines, it's a pleasure to have you with us. Welcome.
Thank you so much, Raquel. It's a pleasure to be part of this initiative. I think it's really wonderful that you're promoting this kind of podcasts that not only help healthcare professionals, but the wider public. If they listen to the podcast, they might listen to something that they think, oh, this is me, this is what I need to do, this is the support that I need. So I think it's very valuable what you've been doing here.
Thank you. And before we get into the clinical aspects, I'd love to hear a bit about your own journey. What drew you to specialize in wound care and how did it cross into the oncology field?
I started as a nurse in Portugal. I worked in Portugal for 5 years in an intensive care unit. So since then, I've been working with oncology patients. Even before that, even during nursing school, a school that no longer exists. That's how old I am. But I did my nursing degree at IPO de Lisboa. They used to have a nursing school attached to the hospital. So throughout my academic life, I was also exposed to a lot of oncology diagnoses, oncology situations. So it's something that came from that time. And I also gained a lot of knowledge and skills in that area that helped me in the future. After working in Portugal in intensive care, I moved to London in 2014. Continued to work in intensive care, but wound care was always my other passion apart from oncology. Those are both my biggest passions. So when there was an opportunity, I was able to start working with a tissue viability nurse. And that's when I started to develop my skills around. In 2018, that's when I became a nurse specialist in wound care. And since then, I've continued to develop my competencies and to gain the knowledge that I have at the moment and being able to work as an independent nurse consultant, which is my role here in Scotland, that I moved over a year and a half ago. And I've been very lucky to be able to develop up to this role, which is one of the highest roles in terms of nurse specialists here in the UK.
Thank you. Thank you for sharing. It's a great background. And I want to ask you from your perspective, what is the most important contributions that nurses make to a multidisciplinary care? And more specifically, for those who may not be familiar, what exactly is a wound care nurse specialist? What role does this type of nurse play within the oncology multidisciplinary care?
So starting with the first part of the question that you mentioned in terms of what is the contribution of the nurses in general, I think it might sound as a cliche, but we are really the ones that are 24/7 with the patients. So depending, of course, where you work, if you work in an outpatient area, it wouldn't be for 24/7, but the majority of the nurses, either if you work on a ward in intensive care, you would be with the patients 24/7. So we are privileged to have that relationship with the patients, with their carers, with their family members. And I think that's one of the differences between nursing and maybe other areas of care, is that we spend so much time with the patients, that we have that rich experience with the patients and learn a lot from them. We also, as you know, from nurses, we look after since people are born. So we might be in the delivery room until people are in palliative care, or if post-mortem, if that's the situation. So across all fields and throughout the patient's lives, we are always there with the patients. The other thing I think it's very valuable in terms of nursing care in general, but also as a specialist nurse, is I like to see us as the glue between the different multidisciplinary members of the team, because we will not only need to refer the patients to other specialities, because even as a nurse consultant, you don't know everything. So you will always have to refer and to liaise with other specialities. But because we are always in the middle of it, we might have to refer to the dietitian, to the healthcare support worker, the occupational therapist or physiotherapist. But they also come to us to find out more information about the patients, because we are with the patients the majority of the time. So I feel that we are a little bit of the glue between the patient and the healthcare professionals. In terms of specialist nurses, a specialist nurse in wound care or tissue viability, depending on where you work, it's basically someone that developed their competencies further. So there's different routes to become a specialist nurse. But for example, in my case, I started helping the tissue viability nurse as a tissue viability advocate, which is someone who is already interested and has some knowledge in wound care and is looking for developing their skills further. So I started to work with her, and then by being mentored by her, doing courses, going to networking, webinars, conferences, developed my skills further, and then became a nurse specialist. I think it depends as well the type of nurse specialty, that you work on. But I think the main important thing here is, as a nurse consultant, you're able to work independently. What does that mean? It doesn't mean that we're working in a silo, but it means that we can make decisions for the patients and their families in this area of care. So we don't need to wait for others to let us know what to do. We're able to assess the patient holistically and then create the care plan with the patient. And then, of course, involve everyone that needs to be involved in the patient care.
Thank you for clarifying that. Many people might not associate cancer with wounds, but skin integrity can be a significant issue. What kinds of challenges do people with cancer face when it comes to skin health and wound healing?
So there's a variety of challenges, because these patients can have wounds caused by the cancer itself, or they can suffer from skin deterioration because of the cancer or because of the treatments. So unfortunately, is a group of patients that is really high risk for developing any skin condition or developing wounds. The therapies, they are advanced. So in comparison to when I started in Portugal to nowadays, there's much less skin damage from chemotherapy and radiotherapy, because of course the science has advanced. But we still see some patients, especially if they've been going through treatments for a long time, or if their overall well-being is affected, they are still having side effects that could be wounds or mucosal damage, for example. It's still something very that we see often with these patients. I think other challenges that they face is, as everything else, unequal access to care, and especially to specialist care. I don't know exactly how it is at the moment in Portugal, but here in the UK, we usually say it's a lottery. Unfortunately, it's a postcode lottery. So different patients living in different areas might have more or less services or access, especially to specialist services. So unfortunately, it's one of the challenges they face. And as you know, oncology patients have so many different needs that they won't be able to be looked after just one person. And that makes it more difficult, because it's very difficult to find an area where you can find all the specialities together. The other thing is, depending again on where you live and the type of services that you try to find, there's also the costs of the products or the equipment, because if you go to NHS, which is the national healthcare system, it's majority of things are for free. But as I can mention, for example, with scar therapy, it's not something that is offered through the National Health Service. So if people need, most of the times, depending again on where you live, but most of the times it's not offered. So if you need that service, you will have to go privately. So all of that will have extra costs. And in not just the cost of the treatment itself, but everything else, going to the hospital for appointments. If you don't have a hospital that has all the treatments, you have to go somewhere else, going to your GP practice. So there's a lot of costs involved in wound care and in oncology care. And the other thing is, unfortunately, in different countries all around the world, it's the waiting lists as well. So not just for the oncology treatments, I think that's getting better and better. But in terms of accessing specialist care, for example, wound care, depends again on where you live. You might have to wait for a few weeks or even a few months, depending on the issue is or how specialized is the service that you need. In terms of scar therapy, the other thing that the patients usually face is scar therapy is still seen in a lot of places as an aesthetic procedure or to help just with your body image, but it's not. So especially for a lot of the skin damage that you see with patients that go through oncology treatments, it's really affecting their function and their daily living. So it's something that we need to try and change the mindset of the general public, but also the governments, to see if they will be able to support this kind of treatments, because it's really helpful for the patients to be able to mobilize better and to live their lives with better quality.
For sure. Let's talk about the kinds of wounds you most often see in oncology. What types of wounds are common among people living with cancer?
So as I mentioned before, there's different reasons why the oncology patients might have wounds. So just to give some examples, if we think about the cancer itself, they might have what we call fungating wounds, which are wounds caused by the cancer. And most of the times, unless you're able to remove that cancerous cells through surgery, for example, or through other treatments, it's not healable. So it's one of the things that sometimes I say we need to be really careful to manage the patient's expectations and really discuss everything with the patients, because some wounds are not healable. So what we need to do is support the patients and their family members and carers to go through the symptoms and minimize the impact of the wound. So this is something that it's not for all the patients and it's not that common, but it does happen. And the more and more we see patients with oncology diagnosis, is something that unfortunately we're going to see more and more in the future. Other types of common wounds are surgical wounds. A lot of patients with cancer will go through surgery. So if there's no prevention, or if the patient already has some comorbidities or already had some previous wounds in that area, they're more prone for wound complications such as infection or wound dehiscence. So it's another type of wound that we see a lot in oncology patients. As I mentioned before, chemotherapy, radiotherapy, they might lead not only to wounds, but skin conditions. So in those instances, of course, we'll have to have the support from a dermatology team or a dermatology nurse specialist. But it's also something that is very common. And two other things I would like to mention is one of the things I think it's more common is because if the patient has low immunity, they're more prone to fungal infections. So there's a lot of patients, and that's why education is so important, that patients think, oh, I'm getting this weird rash, or even the healthcare professional doesn't know what to do, and they start giving antibiotics and other things to the patients, and what they have is a fungal infection. I think if you're specialized and if you're like a ward nurse or someone that works with oncology patients on a regular basis, it's easier to identify. But if you work in a general ward and you're not aware, you might also think, oh, the patient is having an allergic reaction or a rash. And it's not, and it's a fungal infection that needs to be treated accordingly. And the other thing, which again is not common, but I think it's common in a subgroup of patients, is patients that go through bone marrow transplants. So it's something that we see happening often depending on where you work. But these patients, unfortunately, they can develop something called graft versus host disease, which affects different organs and different systems in your body. And one of them is the skin. So they will have a lot of complications in terms of their skin. It might not be wounds, but skin conditions that come from that, from the treatment. So apart from that, the patients are also at very high risk because of dehydration, not being mobile, all of the other things that affect your risk to have skin damage. They're also at risk of other things that are more common in other patients, such pressure ulcers, skin tears, so things that are not specific from oncology patients, but they could be affected because they're more at risk because of the overall well-being.
And we know that wound healing can be impacted by the different phases of the treatment. During which phase do you see that this is more significant? And what are the main factors that hinder wound healing in cancer patients?
So unfortunately, it's across the entire journey of the patient. So if we think about patients that have to go through surgery, as I said before, prevention is very important because they're at higher risk of wound complications after the surgery. If they're having chemotherapy or radiotherapy, they can develop dermatitis, which can go from moderate to even severe dermatitis. Patients that go through chemotherapy, they can get something called the hand-foot syndrome, which also affects the palm of the hands and the soles of the feet. Can be tingling, blisters sometimes, or very dry skin, and sometimes very painful as well. So there's a lot of things that can occur to the patients during the treatments. The other thing that I think it's important to highlight is with radiotherapy is very like a niche area, because sometimes the patients don't see anything during the treatment and the side effects will be seen a few weeks after. So again, it's something that unfortunately can happen to a lot of these patients, even if it's in a moderate stage because they had good preparation for it, but it's something that can still occur. So there's not a specific phase of the cancer treatment, is across the board, unfortunately. And I know you mentioned palliative care as well. It's another time where the patients are very fragile, especially towards the end of life. So as skin is one of the organs, sometimes we forget skin is an organ and all the organs will be failing. So the skin will also be more at risk or more prone to skin damage. So it's across the journey from, I wouldn't say the diagnosis, unless they already have skin cancer or other types of cancer that can lead to wounds. But in terms of treatment, is across the whole journey. The patient might have some skin conditions or wounds.
Thank you. And in the difference of the clinical approach, what is the difference between treating a wound in a curative context versus a palliative setting, as you were saying?
So I think it's very important for people to understand that when we talk about wound care, we really need to do a holistic approach. So we need to think about the patient and then the wound. So for even the same type of wound, you will have different approaches because the patients will all be different. So if we think about curative or palliative, I think the main difference, or I would say the only difference, would be depending on the patient's needs and patient's wishes. So for example, if we're talking about palliative, patients can be in palliative care for weeks and years sometimes. If we think about the end of life, sometimes we won't be doing some of the procedures that we would do for other patients because they will be deemed as futile. So for example, one example is the sharp debridement. It's something that can be uncomfortable, even sometimes painful if not managed properly. So it's something we probably won't be recognizing or identifying as something that will be beneficial for this patient at the end of life. We will still use it if it will be beneficial for the patient, but we really need to make sure that we're going with the patient's needs at that stage. So that's why in wound care, we also reassess a lot of the times and all the factors that can affect wound healing will have to be assessed, like you asked before, in terms of the main factors. It could be, as I said before, nutrition, hydration, if the patient has any mobilization impairment, medication. There's a lot of things that will have an impact on the wound healing, and those will be, they will need a better understanding of the patient, especially if they are in palliative care or end-of-life care.
For sure, it's important to be attentive to all of that. And from your recent certified in scar therapy, which is such an important aspect of recovery, can you explain how scar care contributes not just to physical recovery, but also to emotional well-being? You said a little bit before, but I just want to make this a larger question because I think it's a truly important topic.
Yeah, thank you, Raquel. I think it's a very crucial part, because we all always think, and that's why I decided to learn a bit more and become a scar therapist, is once you finish with the wound healing, we really don't know much what to do. During all the courses I've been through, they might touch a little bit on make sure the patients use sunscreen, make sure the patients don't. So some of the basic instructions that you should give a patient once the wound is healed, but overall care and how to do scar massage and other therapies, we are not taught when you're a wound nurse or a tissue viability nurse. So I think it's very important, because physically, of course, the body image of the patient will be paramount for us to try and help as much as possible, but all of that will have a major impact on the patient's mindset, their well-being, and also at the same time as wounds, scars is a continuation of the wound healing process, is scarring. So if everything is not looked at, it can deteriorate, and the patients can have a keloid scar or a scar that is never going to be fully matured or fully healed. So in terms of the patient's well-being, there's a lot of studies that show that can have devastating impact on the quality of life, and then it can lead to social isolation, feelings of shame, even depression. So it's really something that is very valuable and important for the patients, not just for their body image, but for their mental health. As well, as I mentioned before, this cannot be seen just as an aesthetic treatment, because the patients, especially oncology patients with large scars or multiple scars, because they might have to go through different procedures throughout their journey. This can, for example, if you have a surgery and you're not able to mobilize your arm as you were before, this can have a huge impact on your life, your daily activities, your job. So it's like a snowball. If something is not being looked after, it could have an impact on everything else. So your mental state will have an impact on your physical abilities and the scar or wound healing. But if the physical part is not looked after, it will have a major impact on your mental health. And there's a lot of studies that show that patients with wounds, but also less studies with scars, the type of the consequences of that to the patients. So I think it's something we need to look at a bit more and have it more available for patients.
I completely agree. And that leads us to the next topic. Beyond the physical interventions, how do communication and therapeutic touch influence outcomes in wound care?
So that's an interesting question, because in nursing, at least when I was in nursing school, this is something that we talked every month: communication and therapeutic touch. I don't know if people are aware, there's something called the 6 C's. I think now they increased the C's, but there was before something called the 6 C's of nursing, which include not only communication, but care, compassion, competence, courage, and commitment. And I think this really shows that throughout all these years since nursing started, it's something that we really have as a core value and a core thing that we need to develop as nurses. So you're dealing with people, you're not dealing with the wound. So you really need to make sure that you're communicating in a way that allows the patient to ask you the questions that they need, that they feel comfortable with you, that they feel confident, that if they ask you something, you're gonna try your best to answer. Again, we don't know everything. So if you know something, be open and honest with the patient and say, I'm not sure, but I will find out, or I think you will need to be referred to this other colleague because they have a different specialty and this will be something that they will know. So I think communication is key for your day-to-day interactions with the patients. With oncology patients, they're going such a fragile time of their life that having compassionate care and communication, it's key. You don't want, and myself as a patient, I don't want to go to a service and have a nurse that it's very abrupt, or that it's not kind, or you can see that she's not listening to what you're really saying. So I think that's really important. Also, what we call active listening is not just talking and sending the message to the patient and saying, this is what you need to do when you go home, or next time you come to the appointment, is really leaving time. I know it's very precious, the time we have at the moment with patients, but really leaving time for questions, or asking the patient to think about questions for the next time. Because otherwise they will go home, they will have the same doubts, or they might be a bit ashamed to ask. So communication is really important. And I think another thing related to communication is education, that we already mentioned. You need to really adjust the type of communication or strategies that you're going to utilize when you're talking to the patients or your colleagues to teach them about something. Otherwise, it's not going to be a meaningful interaction. In terms of the touch, in wound care, you'll have to touch the patient most of the times, unless you're like me, a nurse consultant. Sometimes I give advice to staff, but the majority of the times you will have to touch the patients. And again, the basic nursing values of keeping dignity of the patient, making sure that you get feedback from the patient, because you're cleaning the wound or you're doing debridement. You know that some things are uncomfortable, but you don't know the level of pain that you're causing or discomfort. So you need to always get feedback from the patient during the procedure and after the procedure, to make sure that the next time, or that you diminish that possibility of being an uncomfortable situation. So definitely touch is something that we need to think about when we're doing wound care, or scar therapy is the same.
For sure, touch and communication are key, but also, as you said, education. So what is your perspective on the importance of patient and family education while preventing complications in wounds?
I think it's very paramount, because, as you know, the patients will come to have a consultation with a doctor or a nurse or whatever healthcare professional they're seeing, but they only have limited time with that person. So one of the things we try to do with my team is always have time to not only educate the staff, but to provide education for patients. Because we don't see a lot of the patients face to face, we try to encourage the staff to do that kind of education, or we support with education resources. But in my private work, I do that. It's really important for the patients to understand why is this happened. So if it's something that can be avoided in the future, they know what to do or how to treat. A lot of the times they might not have support at all times when they need to change the dressing, for example. So you might need to teach them how to change the dressing, making sure they know that they need to wash their hands, for example, to avoid other complications such as infection. So I think it's really key. And if the patients cannot do it by themselves, because it's in an awkward position in a part of their body that they cannot reach, or if they are more frail and they can't do it, it's really important to teach their family members or carers on how to do those procedures. The other thing that is really important, and I think sometimes we also miss that a little bit, is really ensuring the patients are aware of signs and symptoms of things that are not normal. Because if they wait until they have fever, for example, or if they have a lot of pain, that's already a gap of care that could have been provided, or information. So it's really important to tell the patient, if you feel this, this, and this is not normal, or if you already have this pain, because again, we cannot live, unfortunately, in a magical world where everybody will have zero of pain or uncomfortable or be uncomfortable. So sometimes, because of the disease, the patients might already have some underlying pain levels that are being managed, but for the dressing change, they might need extra analgesia, for example, or they might need some non-pharmacological ways of releasing the pain, such as aromatherapy. We do a lot of aromatherapy, color therapy, just basic distraction techniques to help with that. So it's really important to tell the patients if suddenly the pain increases and it's not subsiding with what you have. So those kind of informations are really important for the patients not to suffer waiting for the next consultation, or for the patients to know, oh, this is not normal, I need to find out what's happening. Because with surgical wounds, for example, if the infection progresses, it might become serious, very serious for the patient, and have a big impact on their life. So it's very important to teach them how to prevent things, but also what to look for whilst they're not under our care in the hospital.
I agree. Can you specify some signs specifically? I know you said when they get fever, but that is already in a late stage. So in the beginning, do you have any examples that you could share?
So basically, it will depend on the signs and symptoms will depend on the type of wound that they have or the type of skin damage. But I think the main thing we need to tell them is to check their skin, because they might have already have some small skin damage, but they need to checking regularly to see if it's expanding or if they have more wounds than they had before. Skin temperature, see if there's an area that is very red, very hot. It means that it's either inflamed or it could even be infected. If there's a change in the fluid that is coming out from the wound, that can also be a sign that something is not going well. And as I said, the pain as well. So if the pain suddenly increases and it's not subsiding, and also I think it's important, for example, if the patient has never tried a type of product, skincare product or a dressing, it's important to highlight things that can happen. For example, they might be allergic to it, but we don't know. No one knows because they never used it. So it's important to say, if you start having this tingling sensation, or if you start to feel that it's painful or is stinging, please remove it and use something else, or give them option. Always give them options, otherwise the person wouldn't know what to do. And sometimes we say, oh, keep the dressing and then you will come for the next consultation, but we really need to make sure that they know what to do if something goes wrong. But I think that will be the main things I would say is do regular skin checks, the skin temperature, the color, and if there's any new wounds, and the pain.
Thank you. And regarding products, as you were saying, have there been any recent advancements, either in products or techniques, that you find particularly promising in the management of wounds?
Yeah, so wound care, it's a big industry out there across the world, the entire world. It's not specific to UK or to Portugal. It's across the world. It's an industry that has been gaining a lot of attention in the last few years. There's a lot of changes, so that's why it's so important education for staff, because the dressings might seem similar, but they might act differently, and you're then not using the right product for the right patient. In terms of, I think there's been a lot of work done to try and make the dressings or the products more comfortable for the patients to use, more adaptable to the area of the body, for example. So if you have a dressing in a joint area, you don't want it to become wrinkled or start to come off earlier. So there's been a lot of work around that. Exudate management, which is one of the things that affect the wound healing. If there's too much exudate, can also damage the peri-wound skin. So there's been a lot of work around how the products work and try to make them more appropriate for the patients. There's also a lot of products that try to help, for example, with pain. There's products that incorporate either medication or other factors that are released into the patient, to the wound, and that help with pain management. So that's been something that has been going on for many years, but it's something that has been very positive. And I think the other two things that I would like to highlight is really there's been, I think, more funding available for research, which I think is very, very important, not focusing just on the products, but strategies, how to help the patients to self-care, because we know that there's not enough healthcare professionals for the amount of patients we're having with certain types of wounds. And this is not a problem that is going to be improving with the life expectancy and comorbidities that people have nowadays. We expect more people, unfortunately, to have different wound types. So we need to make sure that the general public has an awareness of their conditions and how to treat the basics, at least, of how to treat these wounds and these conditions. So I think it's been really good to see that there's a lot of effort and research around how to support the patients, how to implement pathways or programs that help the patients to self-manage, or the carers how to care for the patients. And I think one of the latest things that's been happening probably since COVID, it's something that has been developed more, is telemedicine and the use of AI in healthcare. So I know there's a lot of debate and it's very controversial. Is it something good? Is it something bad? Are we all going to lose our jobs? I don't think, personally, I don't see it in that way. I've been using telemedicine and starting to use some AI to support healthcare professionals. So for example, here in Scotland, we have to support patients that are living in rural areas. So it might be 3 hours or more if we wanted to come and see them. So if we can use telemedicine to look at the patient's wounds and find out what's happening with the patient and tell the nurses that work locally what to do, it's much more efficient than having to go there and spending one full day of work seeing 2 patients, for example. So I've seen the benefits of telemedicine in my current job. In terms of AI, I think if you can use AI to help you, for example, to do your nursing notes, you just have to review them and save them, and that's it. Instead of writing and typing for 1 hour and remember everything you need to remember, or to share things with other healthcare professionals through electronic records. So I think telemedicine, AI, and electronic technologies, let's say in general, can be very beneficial for staff. You don't go to a hospital and people in different departments will ask you what's wrong with you, because everybody will have access to the patient's records. So you don't have to repeat yourself all the time. So it saves time for the healthcare professionals, but it also gives the patient a better experience. In terms of education, I think it's really good as well, because it allows you to keep things online and people can watch. Even for patients, there's a lot of videos to support them in wound care, how to do a change of the dressing, how to look after their comorbidities, who to contact as well. So it's very important to have these resources online. And I know there's a lot of companies now doing as well, like phone calls through AI. I've never been involved in that, but I think there's a place for it. I don't think it will ever replace healthcare professionals. Again, the AI will never be able to communicate the same way, to be empathic in the same way, or to the therapeutic touch in the same way, I think. But I think if it allows us to do things faster, the admin side of things, it will save us more time to be with the patients, which is something that we know nowadays it's very difficult because everybody has to fill in so many forms and then a referral form to someone else, or, oh, let me look at the latest note, let me add this to the notes. So if those kind of admin things can be done through technology, I think that would be it's going to be a great thing to be using. But I know it's very controversial.
It is a controversial topic, but I personally agree with the admin and bureaucracy stuff. It really is helpful, and we are starting to become in our final stage of this episode, and I wanted to switch into the reflections. And I wanted to ask you regarding patients or caregivers who might be going through this experience about wound healing or scar healing right now, what words of encouragement or guidance would you offer for them?
I think the most important thing is really for people not to feel ashamed to ask questions. No question is a wrong question or a silly question, because if you go home and you don't have all the main questions answered, that's just going to create more stress. It's going to create more uncertainty. And as I mentioned, in terms of specifically of wound healing, that has a major impact. So it's like a snowball. Your mental health will affect your physical health, and it's going to be like a circle. So it's very important for people to make sure that their questions are answered. If there's no time in this session, maybe leave it for the next session, because we know, depending on where you work, you have more or less time with the patients. I think it's also very important for them to know that there's support out there from support groups that can help them, not only with the medical side of things, or where to find the specialist and this kind of information, but also where they can find other people that are in the same situation as them or were patients previously. There's a lot of benefits in that. Some people might not want to be involved in those support groups, but there's a lot of people that find that it's really helpful, because people will give them hints and tips on how to do things, how to find information, and even to socialize a little bit, because these patients, especially with visible scars or visible wounds, sometimes they tend to social isolate. But if you know you're going out with a group of people that have faced the same things or are going through the same things, sometimes it's easier to identify yourself with those people and to be more open to them. I think that will be my main thing, is never leave any question unanswered, and try to find support groups in your areas, because the feedback we have from patients, it is very, very valuable to be able to ask someone, even if it's something simple as, oh, where did you buy this? Or how did you find this kind of specialist nurse or specialist OT or physio or anyone else. It's easier than them trying to find by themselves. So I think support groups is something that is really valuable.
It is. It's a truly important. It has a truly important power, the power of community. And for a question regarding the healthcare professionals, what could they do? What is your reflection to them?
I think for the healthcare professionals, it's always don't stop being curious. I know sometimes it feels like it's a never-ending process and you're always learning. But the thing is, as things evolve, and in the last few years, things started to evolve so quickly that you really need to be up to date with what is happening. You wouldn't want yourself to go and speak with someone and have a treatment that used to be provided 15 years ago. You want to have the latest evidence-based care and the latest things that could support you, not only physically with your wounds and the products, but mentally. There's a lot of apps nowadays, for example, for mindfulness, and other things to support the patient. So it's important for us as healthcare professionals not to just focus on the physical aspects, but to look at the patient holistically. And again, we don't know everything. I don't know everything about wounds or how the wounds affect the patient. So you need to bring a psychologist or a psychiatrist or a counselor even. So it's important to know who your resources are available in your area, and then liaise with those healthcare professionals to be able to provide the best solutions for the patients. And another thing more specific for wound care and scar therapy, I would say it's really good for you to be part of a association or society related to that subject, because it's much easier for you to get all the bite-sized information of new things and new events that happen online or face-to-face. You can, if you're interested in research, you will get the latest journals. So being part of an association or society, I think it's very valuable. Or if you don't want to be part of any of this, you can find those journals yourself. There's a lot of journals out there related to wound care, tissue viability, or oncology, nursing, that are very, very interesting to read if you want to know what's happening, or things that people are trialing at the moment, and you might think, oh, this might be something good for my patients. Maybe I will get in contact with them and see what the results are they getting, and maybe we can start using the same strategies or procedures.
Speaking about getting in contact, where can our listeners find out more about your work, connect with you, or follow your educational content?
So I'm in different platforms, so it depends on where you want to find me. So I have a website, www.woundwellbeing.com. You can find me on LinkedIn, both on my personal page, but also I have a business page. And on Instagram, it's still starting to be developed, but you can find me on wound_wellbeing on Instagram.
Thank you for sharing. And Ines, thank you so much for joining us today. Your work is a powerful reminder that healing goes far beyond medication. It's about comfort, dignity, human connection, and AI will not substitute that.
No.
And thank you so much for being with us today.
Thank you.